So in the morning we arrive, we have 4 people that work together. Well, we have multiple people to work together, but we have a team of 4 that are sort of pinpoints or the nexus of other teams. So we have dashboards that we've created based on information systems that we have in the hospital that pull information together to give us a snapshot of what's going on coming into the hospital. Some of the issues that may crop up around delays in care, like how long it takes a patient to be seen, consultation delays, testing delays and whatnot. And then on the other side is how are we going to accommodate those patients. So we have information about who potentially could go home today. What are they waiting for? Are there teams that need extra help because they have a high workload of patients? Can some of those patients be transferred to other services because they have some wiggle room in their census that they are able to care for that patient and the patient is appropriate for that? The main thing that we noticed is that once we all are on the same page, the patient becomes our patient, not my patient, not your patient that we're trying to pass off. We all work together to try and find the best place for this patient to receive their care.
The trigger for us was COVID. As of the 3rd wave, we started seeing accessibility to beds and hot beds were becoming critical. So we needed to figure out how to basically improve on how we interconnect all the teams of the CIUS and focus on a need.
By bringing all of the teams together, we're essentially breaking down the silos across the organization. We're allowing for that collaboration and communication to happen. And we're also seeking from the people sitting in the room, what is the information that they need to be able to give the best action and the best care to the patient in front of them. So although we're very much in support of this system, the numbers that you're seeing on the board here, they weren't decided by any of us. They were decided by the frontline teams who are really the ones that are actioning on the numbers that they're seeing on the table. Shannon said it a little bit earlier, we want to make sure the patient is in the right place to receive the right type of care. So although they're moving through the system and we're using the numbers to help engage in that discussion, the whole objective is to make sure the patient is being treated appropriately in the right location, not to just make them run through the system faster.